we're live.
Okay, and you're recording,
Yes.
and can you let the media in?
Yep, they should be coming in now.
Thank you.
You're welcome.
Okay, we're going to go ahead and get started. Welcome, everyone. We are talking today with Tim Jakacki from the Emergency Operations Center. He has been heading up the Donate TLC Supply Warehouse, and Rachel Gagnon, Executive Director of Toledo-Lucas County Homelessness Board. But we're going to begin first with Toledo-Lucas County Health Commissioner, Dr. Eric Jasinski, with some announcements today. So Tim and Rachel, if you would please turn your cameras off. We'll start with Eric today. And Eric, we want to begin by clarifying that the Ohio stay-at-home order is still in effect.
Yes, you do know that it was supposed to go out on May 1st, which was today, but there was an extension signed yesterday, last night, relative to the stay-at-home order. So that is going to be in effect until May 29th. Again, it's going to be a little bit different than the last one because we have some businesses that are going to be opening up, which is good news. But again, I urge everybody that if you don't have to go out, don't go out. Let's stay at home for a little bit longer, but understand that we can get those things that we've been looking for to get, but just be responsible about it and limit your travels as much as possible.
We also have some additional information to share, a little bit of a change in our COVID-19 hotline number.
Yeah, we are changing up the hotline numbers a little bit. We've had some hotline activity decrease, especially those after hours. So what we wanted to do here is, again, effectively use this resource, make sure it's still available. So here are the numbers that you can call if you're experiencing symptoms or have medical questions. And from now on, the line will be open from 7 a.m. to 7 p.m. Monday through Friday. If you have calls outside those hours, you can leave a message and someone will call back to you as soon as possible. And probably the next day. But again, if you're experiencing issues that you need emergency help with, please make sure you dial 911 and have those issues taken care of.
Right. We don't want to be waiting for a call back the next
Correct.
day if you have medical questions.
Most
there.
definitely. Yes. Yes.
Okay, Eric, the governor laid out the first phase of business restart last week, and we have a graphic to show some of those here as well. So we know that as of today, healthcare providers and some of those non-emergency surgeries, elective surgeries, are able to be started back up. Also on May 4th, we have some other openings of general office environments, manufacturing, distribution, construction, and then consumer retail and services back up again on May 12th. And as businesses are reopening, a lot of owners and managers are probably wondering about new regulations, PPE, other responsibilities that they have as they reopen in this new environment. So your department has put together an amazing guide and has been collaborating with the Toledo Regional Chamber of Commerce to be able to get this information out to the public.
Yeah. You know, again, we can't do all this on our own. And so there's been some great partnerships between the Chamber, Mike Hart, the Board of Health, the Health Department. So there's a number of different entities that have been working on this. And I think we do have a great document to share. And it is really a good foundation to begin opening your businesses. But again, we're probably all going to be wondering about PPE use and other responsibilities as we open up these facilities. Again, my department has had some ability to help craft this and really look at the public health aspect and what we need to do to protect ourselves. There's a whole other gamut about the business operations, but I really want to stress to all our owners and managers and leaders of these organizations and buildings that are going to be opening back up. make sure you understand how to best protect your staff and also the public. And this guide is going to help you. Again, it's laid out in a document that I think is easy to read. You can understand what needs to be in place even before you open. Again, I would take the time right now, much like we did at the department, to lay out how we're going to be able to open up safely for both staff and customers. Again, the documents on our website. It's also on the Chamber's website. So there's a lot of great information about economic resources, again, that planning ahead activity, suppliers of equipment and or things that you might need to open up. I would also caution you, again, for some of those facilities that haven't opened up in a while, there's some safety concerns that you're going to have to address. So again, make sure you're doing that. I think that the bottom line is the health department's here to work with any business that needs help. We're definitely here to, walk you through any of the documents you might need to walk through, any of the planning. So please just make sure that you're able to contact us. And if we have the graphic up there, I think there's a number that we can call. Here we go. And again, 419-213. Again, it's 4161. So you've seen that number here before. Press 4 and please, leave a message. If we're not answering that, we're going to get back to you and help you out. Again, it is really important for us to be there for the community. And our business partners that we so desperately need right now. And we're going to try to make it as easy as possible for them to actually get up and running.
Okay, so they can call you ahead of time.
Please.
And again, they need to understand too that the supply chain might be a little bit delayed. So now is a
Sure.
really good time to be looking at that document and planning ahead for the future. Let's talk a little bit about masks and face coverings though, because this is something that I think has caused a little bit of confusion. I know your staff will be wearing them at the Department of Health,
Yes.
Eric, and visitors to your building will have to wear them. And this is something that businesses are going to have to decide kind of on a case-by-case basis, right?
Yeah, correct. Again, we are still going to be dealing with COVID tomorrow, next week, next month, the rest of the year, until we can really, again, get a vaccine out and really help us combat the COVID more on a permanent basis. So we have to take those steps that are going to best have the ability for us to not spread this virus throughout the community again. And one of those things is a face covering. Of course, we would love to have face masks, but that supply chain is not there yet. I don't know when it's going to be. And those masks really need to be used by those individuals who need to use them. So the next best thing is that face covering, as we've talked about. Inside of the health department, my staff, I are all wearing face coverings. The individuals that are going to be walking into to the department are also going to be wearing face coverings. So it's really important for us as a health department to make sure that we're actually doing what we should be doing and leading the way through utilizing face coverings. Again, I want to make sure that we understand that originally, I think the government was looking at mandating face coverings for everybody. I do believe that's no longer on the table. But we really, in this community, need to seriously think if it is the best thing to not wear face covering as an individual. And it really isn't, because we are taking the chance, because we know this disease is asymptomatic for many of us. And we may not know we have it, and we're spreading it to somebody else because we just don't take that extra step to wearing a face covering, where we could really limit that ability for somebody else to catch it from us if we have it. Again, there's weapons out there that we can use, and one is a face covering. We've talked about some of those other ones about washing our hands and that social distancing. So all these combined is really what we need to do to make sure that we stave off any future infections, future issues of going from person to person with COVID-19 in our community, because we don't want to be back here again and having to be, if you would, shut down. And so we all need to make sure that we have the ability to take it upon ourselves to do what's right. Again, the idea of a face covering, for some of us, it's tough. I know I really don't like it, but again, it is something that we should be doing, and it's not that hard to do.
And a sign of respect, I think, for our friends and
Yes.
neighbors, right?
Yes.
So Eric, a lot of people are wondering, where can they get them though? And I've seen, some ads that people have, American ingenuity. People are making these and putting them out there, but there are places that people can get them as well.
Yeah, again, I have some friends that are making them. These aren't those surgical masks that we're talking about. These are those cloth masks with some elastic maybe, or they tie behind your head. That's kind of what we're talking about here. But again, you get them on the internet. I know that, like I said, people are selling them that I know. A scarf or bandana is a quick fix as well. Again, what we're trying to do is make sure that droplets from our nose and our mouth aren't getting out to somebody else. So, that is one great way that, you can help protect others by wearing that scarf or bandana if you don't have one of those masks. I really want to make sure that we understand too that, there are some efforts out there to make sure that, people who may not have them have at least the ability to get them. And I know that the city just got a grant to distribute some masks in our neighborhoods to our most vulnerable populations, which is really important. Some stop and goes and stop and shop locations in some of these vulnerable populations where they live, they're actually going to be distributing those. But what we really want to do is make sure that everybody is prepared. And so this is a great idea. People need to be prepared to just like businesses be required to wear shoes in the stores, wear shirts in the stores. We should be also anticipating that we will be wearing a mask in the store, because I do feel that some stores will say, got to wear shoes, got to wear a shirt, and you got to have that mask on. If not, then, I'm sorry, you can't shop here. So again, we all need to be prepared to take it upon ourselves as our individual responsibilities to protect other people in our community. And these are just great ways we can do it.
Okay, Eric, thank you so much, and stand by. I'm sure there will be some questions for you in just a moment. So you can turn your camera off, and we want to bring in Tim Jakacki now from the EOC. He has been running the warehouse operations for Donate TLC, which is the program put together very quickly, Tim, that started operating about just 5 weeks ago. What kind of response have you had at Donate TLC?
Now, Chris, we have had an incredible response. We have had the business community and the I just got to throw it out to the schools and the universities, as well as the actually healthcare offices, dentist offices and veterinary offices, those who have opened up today actually, that actually came forward immediately and brought us some of their PPE that they had to put on our shelves. We have had, I think some of the numbers are pretty impressive, but we've had donations up to 400 and almost 500,000 items. Now, a good portion of that, about 200,000 of those items were from the Ohio Department of Health. Those were masks and face masks and some other PPE that was desperately needed that we were able to get from them. But we have had just an outpouring of support. We had food drives who decided that they were going to add some of the hard good items that we were asking for, we brought a half of a box truck full of items that were donated through that. So from hard goods, if you don't include surgical masks and gloves and face shields and the famous N95 masks, we've had over 10,000 other items donated that we have been able to help organizations and specifically our first responders.
So tell me a little bit, Tim, about the organizations that have been receiving some of these goods, because you've had there maybe a number of organizations that you've been able to help, and where they are coming from in our community.
Sure, Chris. The Donations and Distribution Center was set up as a part of the Emergency Operations Center for Lucas County. And the intent initially was to support the first responders, the police, the fire department, and all of those types of agencies throughout the county. In addition, though, there were essential agencies like the Homelessness Board, like the um, uh, oh gosh, the Children's Services, the Area Office on Aging, who have people that were going into homes and helping to take care of some of these individuals who also needed personal protection. And so we've had over 162 organizations, quite frankly, that have benefited from these donations and the distribution. We have filled over almost 200. As a matter of fact, the data that I have that is accurate is from the 29th, and as of today, I'm sure we have surpassed filling over 200 orders to many of those 162 organizations that have received items more than once because obviously they need it. So.
You all were so stood up already and so organized already that the National Guard decided to use your warehouse as their distribution point as well. How has it been for you all working with them side by side?
Well, Chris, actually that's very true. So, oh boy, I'll say a week, perhaps maybe a week and a half after we stood this entire operation up, we knew that the National Guard was being called in by the governor. And the National Guard had been called in, I believe, earlier to help with food distribution for the needy. What happened is that the states and the National Guard's plan for a disaster and standing up a distribution center for donations is in a location that's in their plan. And we knew that. Actually, it was, I believe, in Walbridge, if I'm not mistaken. And so we contacted the Guard and said, listen, here's what we've got going. Here's where we are. This is what we're doing. And if we can be the regional distribution center for you, we're happy to do that. The only thing that we might need is a little bit of muscle and manpower. So from the National Guard's perspective, I think that went all the way up the chain of command and they approved it. The good news is that it wasn't necessary to stand up a regional distribution center. So the good news is that we apparently did a good enough job that they accepted all that we had to offer and we were willing to do. And then the other good news is that it wasn't necessary to make it a regional distribution. So.
More than 400,000 items that you have been able to collect there, and more than 160 organizations that have been helped, 200 orders filled. This has been a huge success. Tim, has it exceeded even your expectations from the beginning?
Yes, it has on a couple different in a couple different ways, Chris. One is I've never run a warehouse or distribution or been part of supply chain before, other than as a hospital president to simply say, hey, we need, right? And so somebody else was there to do it. Additionally, though, I would just say that it's exceeded my expectations in the sense that it's pretty overwhelming. We always talk about what happens in disasters and how people always come together, and we as a society just pull together and make things happen. But I gotta tell you, the business community in Lucas County has just, I think, just been over backwards. Everything from the healthcare businesses all the way to manufacturing and I mean, architectural firms and places that you would just never even think to call or to look. Some of them just simply reached out to us, and that has been extremely rewarding for me just to live in a community where I know that people care.
People are certainly generous and have been generous to Donate TLC. Again, they are still operating. Donate TLC. You can go to donatetlc.org. You saw that address up there. There you go. And if you'd like to make a contribution to Donate TLC, or if you are a community organization that needs some of this equipment as you're opening back up and trying to get off the ground, then you can give them a call also, or go online and let them know what you need. Tim, we want to thank you. And we want to bring Rachel Gagnon from the Toledo-Lucas County Homelessness Board into the conversation now. And Tim, if you'll stand by for questions, we would appreciate it. And you can turn your camera off now if you'd like. Rachel, what did it mean to you? You received some goods from Donate TLC. What did that mean to you and your organization at this very important time?
So the Homelessness Board supports many different emergency shelters around our community, and we were, really blessed and grateful to be the beneficiary of this sophisticated donation structure that Tim and his team set up. And so we have been on the front lines. We have staff working every day directly with individuals in congregate settings, and so they are a prime category of individuals who need to be protected and to have the resources and supplies that they need. So with the support of Donate TLC, we've had regular distributions coming from the warehouse, usually about once or twice a week. We've got a Jeep full or a truck full of donations, and we go and make the rounds and deliver those to the various shelters. And the shelters, they're operating right now in a very difficult time, and they're always overwhelmed with gratitude whenever we make these deliveries. I remember the very first one that we did right when everything was kicking off. A colleague of mine and I went and delivered one of the first batches of masks and gloves that we had received from the center. And the staff that received it were noticeably or demonstrably choked up with tears in their eyes. And I'm not exaggerating when I say that. And it made me choke up just a little bit too, because they're trying really hard and they're doing really great work. But it is it's a scary time, and it's a dangerous setting if you don't have those. So they were unbelievably grateful, and we could not have made it through the last 6 weeks without this structure here.
And I just want to kind of go back to 5 or 6 weeks ago. It wasn't even, a lot of those items were off the shelves. People were buying them up, and it was really difficult to find them. So some of those items were not even available for you to go out and purchase.
Exactly. Yeah. So it was an access issue in the beginning, and then thankfully that's eased up just a little bit. And now it's just a really seamless structure where we can put in a request on behalf of the shelters. We get it soon thereafter, thanks in large part to all of these wonderful organizations and businesses and hospitals and everybody else that's donating to the cause. And we get these, and they pass right back through to the shelters easily, seamlessly. And that, again, that's to Tim and his team's credit. But I think that's why, when I speak of that very first delivery and how kind of emotional it was, I think it was directly tied to the access, because people were scared. People were getting this news coming very fast, and things were very uncertain. And the shelves were bare. And so they really didn't know. It was a big question mark. And how do we stay operational? How do we support a very vulnerable population? How do we keep our staff safe? And how do we move forward? And thankfully, these came right out of the gate, and they've been coming ever since.
Rachel, thank you. And thanks for all you're doing in our homeless community to make sure that that very vulnerable population is able to stay as safe and healthy as possible during this difficult time. We appreciate your work as well. So we are going to open up to questions now from the media. Again, you are able to raise your hand and ask a question if you'd like to. I want to, Tim and Rachel and Eric are all available to answer questions. We will ask you all as participants, if you are not answering the question, to leave your camera off. Eric, I want to bring you back up first, though, because you have another announcement of something that you just got information on from the health department. And your microphone is off.
Yeah, look, just wanted to pull it up here real quick. Just got this in. Again, I'm a dog lover, so dog groomers may open at 11:59 p.m. tonight. However, all those visits must be by appointment only. So again, dog groomers may open up at 11:59 p.m. tonight. However, it must be by appointment only.
Okay, so another great opportunity for people to be able to take their dogs to the dog groomers, and another set of businesses that are allowed to open under our new guidelines here. Are there any questions? I am not seeing any hands raised from our media partners. Here we go. Liz Skalka from The Blade. Go ahead and open your mic, Liz. Liz, I can see your hand, but I can't see a microphone next to you. Do you want to ask your question in the chat feature? We will get Liz's question from the chat feature here. And was there anyone else from the media that wanted to ask a question of Eric, Tim, or Rachel today? I don't see any other hands. Liz has a question for Eric that has to do with nursing homes. She's furiously typing.
Take your time. Well, I think some of the programs are not updated on phones and other laptops and things, so they're not able to use the microphone feature in those cases. I'm actually surprised how we've been able to go to virtual without too many issues. So.
And I don't see any other questions.
Nothing else today. Wow.
From the media, although we did have a question from Facebook.
Okay.
Someone was asking why people have to wait until they are displaying symptoms before they are tested, Eric.
Okay, so I'll just answer that in a broad sense term. The reason why the idea of symptoms and being tested was that test really really functions best when you have a symptom to say whether it's positive or negative. Again, that's kind of how we looked at it first, as we didn't have many tests. But as you see, the CDC is beginning to open up the tiers, 1s, 2s, and now down to 3, of individuals who could have been exposed to somebody to be tested. Again, we got to remember that the PCR test is one tool that gives us a snapshot in time. And that very second, when that blood is drawn and then it's tested of what that individual has or has not relative to being positive. That virus may take a couple days to actually, we'll just call it, grow in your body. And as it grows in your body, then we can actually test you again to see if you have the virus, because it's been able to replicate. And then we can get a different positive or different negative positive, a different understanding of that lab. So again, that's kind of why we've said you got to be symptomatic to be able to be tested. But as we grow the amount of tests that we have available to us, the tiers are starting to open up.
Okay, Eric, here is Liz's question concerning the nursing home. She's curious about how the nursing home data is being collected. Specifically, how are we determining when patients go from being among active cases to no longer active? Are nursing homes using the testing to determine when a patient is no longer a current case?
Okay, so again, that first question actually coincides with this one. Again, because we didn't have much testing out there to begin with, it was very hard to be able to, again, to utilize that testing to determine the status of somebody's infection. So what we had to do is look at symptoms, look at exposures, do the contact tracing, and nursing homes would then separate those individuals out. I think these individuals over here are positive. I think these are negative. And they would separate both of them out. So that's how they were utilizing the idea of individuals with symptoms versus non-symptoms. And then as we were able to get more testing inside of facilities, you now then have a more definitive, these individuals are positive, these are negative. to the extent that, one nursing home found out that a high percentage of individuals were actually asymptomatic, and if they didn't test them, they would never known that. That's why it is kind of important to test individuals, because if they would have moved those individuals into an area that they suspected not have COVID, but they actually asymptomatic, it could have been, we could have had some problems in that nursing home. So that's really important. And so I would imagine as we have more availability of testing, we're going to be able to retest individuals too, to make sure that they are negative, if you would. But we know the disease course too. We know that 14-day quarantine period is for a reason, and that's the understanding that that disease runs its course for 14 days, if you would, after you become symptomatic. Again, we're talking about symptomatic individuals. So it runs its course for 14 days, and so then you can make an assumption that that person is no longer infectious. But again, some nursing homes are splitting people off after that time. Others are still cohorting individuals who, are out of that quarantine period, but they still don't want them back in with other populations. So every nursing home is doing a little bit different.
Eric, Liz followed up with another question asking you to address the inaccuracies with data. She says, I was told the data uploaded to the state website on Wednesday wasn't correct because it showed fewer cumulative cases for some facilities. Do you know why that's happening?
Well, again, the way that we report is that, we go through all of our data, and we have the data that's submitted to us by hospitals, by nursing homes, by providers and things of that nature. So we take whatever we have and load that up. There could be a lag, but by what what ODH might have relative to us, and we've seen this before. So data is always a moving target for us, and unfortunately, until this all really begins to, if you would, calm down a little bit, and we have a chance to really piece out the data and say, okay, what data is from where, and then do some deep dive in that data. We're not going to have the best handle on it, and unfortunately, that's just the way that data comes in, the way that we get the data, the way that the time frames are. It kind of all goes into this issue of that there's no one set way to get that data in here to be able to report that. I think as you see, it always kind of catches up though at some point in time with the data, with everybody's numbers, and then it kind of it gets out of whack, and then it comes back into line, and again that's all from these different variables that we have to deal with.
Okay, and last question from Liz. Lucas County has the most nursing home deaths being reported in the state. Yeah. Do you believe the county is a hotspot for nursing home cases?
Well, again, I wish I had a crystal ball to say yes or no, and then given a reason why we might be considered a hotspot. From the health commissioner's point of view, I would consider us a hotspot even if we had many less cases, because again, if you don't think that way, you can't plan the right way to be able to respond to nursing homes that are having issues, and we've done that. We've over the last month we've been concerned with nursing homes. We've been working with them to get them to have all the resources that weren't available to them. Again, this testing availability to them now is huge for the ability for them to understand what's going on in their communities and in their residencies. I feel that we need to do even more for nursing homes, for those facilities that are having issues, and there's other facilities than just the nursing homes that are having issues. And I think as we come out of this and take a look back at the data, like we just talked about, look at our issues, that we're going to have to make a decision on how do we, for that second wave, how do we want to actually deploy resources? What else can we do? And understand that we have to start right now to react to that second wave. And that's kind of what we talked about. And I'll get off this topic real quick here. But that's why I talked about we all have an individual responsibility to make sure we're wearing face coverings, we're washing our hands, doing those things we talked about, because this thing can go any place at any point in time. You'll never know it, and it can get back into those nursing homes, into those areas that we've had issues with. So it really is, it really is us taking the moment right now to be in combating for that second wave so that we don't have issues in the nursing homes or other areas.
We have another question from Roxanne Elias at WTOL, and she is saying, as businesses and places start to reopen, whose job is it to monitor if they're following all the rules in place for reopening?
You know, it's going to fall back on to all of us again as individuals to make sure that we're all doing the right thing, reopening our businesses. You know, we as employees have to make sure too that we're helping our employers out to make sure that those things are being done. We're going to be here to help that. You know, we're still working out, I think, with the state on how this actually looks. But as we move forward, and individuals that may want to open up, but they really should be closed, we are going to have to enforce that, and that is something that we will make sure that gets enforced. If you are supposed to be closed, but you are actually opened, we're not going to allow that at this point in time. We want you to open up. We want you to make sure that you can bring in the money you so desperately need to pay bills and to support the employees. But if we can't let you know, if we can't let you open up, we just will not be able to let you open up, and there will be enforcement.
And again,
Yep.
great resource for businesses on the Health Department website or on the Toledo Regional Chamber of Commerce website that was put together by the Health Department. All of the resources that you need to know about reopening your business as things begin to reopen, all the new regulations and guidelines you might be having to follow. So please do take advantage of that document that's available. Really important for folks, a really important resource for folks out there. Are there any other questions from our media today? I want to make sure everybody's questions. Oh, and Roxanne is saying people can still call the health department to complain if they see those infractions.
Please do. Yes.
Okay. And we gave that number a few moments ago. Eric, do you have it on the top of your head?
Yeah, it's 419-213-4161. And you can go ahead and press 4 and leave a message, and we'll make sure that we follow up on it. And again, thank you to the community. We had well over 1,000 calls as we were looking at essential and non-essential. We appreciate that. But again, we want to make sure that we're responding effectively and efficiently. And so if you do have something to report that is wrong, please do.
All right. Thank you, Roxanne, for your question. Any other questions from our media before we sign off this afternoon? Would love to have all of our panelists turn their cameras back on, if you wouldn't mind doing that. We want to thank Eric Jasinski from the Toledo-Lucas County Health Department, Dr. Eric Jasinski, as well as Tim Jakacki from the Emergency Operations Center. He's been managing the Donate TLC warehouse, and the beautiful Rachel Gagnon from the Toledo-Lucas County Homelessness Board. Thank you so much for all the work that you all are doing and for being with us today to answer those questions and give us that wonderful update about Donate TLC and the impact that Donate TLC has had on our community over the past several weeks. Keep up the good work, Tim and Rachel and Eric. And we will sign off now. Thanks for being with us this afternoon.